It's a press statement on all the healthcare workers unions that are mostly serving the public sector, which have been affected strongly by the recommendations or the policy that is being channeled by Salaries and Remuneration Commission. So as this has been brought into our attention based on the notice that came out in October 2021, which intends to abolish a number of labor allowances and also salaries. And these will affect in greater extent the medical doctors, the pharmacists, the dentists, the nurses, the clinical officers, and all the workers in the public sector. SRC, in its act to abolish these particular allowances, and in its act to not involve the public and not involve the unions that are strongly going to be affected, is in contravention of the Constitution 2010, which brings out clearly that any particular action that is being taken by a state institution need to have a public participation. As a union, as KMPDU, we can say categorically that we've not been involved in any public participation to abolish or to remove allowances that are affecting our members, and the same to these other unions. And we could also bring it clearly that the mandate of SRC as per the Constitution is clear, that SRC need to work to ensure that employers retain the workers, that the doctors, the nurses, the clinical officers are retained to work. They need to come with such policies. But instead, they're coming out with policies that are increasing strife and are increasing war and are increasing agitation between the workers and their employers, not only the Ministry of Health, but even the county governments. So this action is not only acrimonious and is not only affecting service delivery, but in a stronger way jeopardizes the need to have a better and a functional public health care. So we are calling upon SRC to immediately approve those allowances and to allow for their payments.
The SRC has continuously and consistently frustrated effort by the healthcare workers union, such as KUKO, KMPDU and KENAN, among others, to engage, negotiate and conclude collective bargaining agreement. These nefarious activities by the SRC must be called out, and the Commission advised to stop causing industrial disharmony in the country health sector.